Welcome to Beyond the Implant, a 10-part series sponsored by Straumann, brought to you by Global Dental Media. Discover the latest advancements and gain the knowledge to make informed decisions about your smile transformation. Subscribe now. Over to the episode.
Okay, so imagine this, right? You lose a tooth, not just any tooth. One where the jawbone itself, like the foundation, has weakened. Kind of makes things tricky.
Definitely.
And that is exactly what we are diving into today.
Yeah.
How dental implants are, well, they're kind of evolving to deal with these more and more complex situations, right? I've got a bunch of really cool excerpts for you today.
Cool.
Focusing specifically on bone loss and the cutting edge solutions.
Yeah.
So think of this as like a fast track to understanding the absolute newest stuff when it comes to dental implants.
Right. Yeah. It's incredible how these techniques have, come about and developed, especially when you think about like how crucial it is to have a strong foundation for an implant. I mean, think of it like building a house.
Oh, yeah.
You need that solid ground,
of course,
for it to stand the test of time.
Exactly.
Right.
It's not just about replacing the tooth itself. It's got to have something, super solid to attach to, right?
Right.
So let's talk about what happens when that foundation, that jawbone, it just isn't as strong as it needs to be.
So basically, without enough bone density, the implant, it just doesn't have the stability to fuse properly. It's almost like trying to anchor a flagpole in like soft sand.
Oh, I see. Yeah.
It won't hold.
Right.
And this can lead to a whole bunch of problems.
Oh, no.
The implant failing, becoming loose,
oh,
or even causing more damage to the bone around it.
So then what can you do? Right. Like if you need that solid foundation, but you just, nature's not really cooperating.
Right. Well, that's where we start talking about bone grafting.
Okay.
It's basically a procedure where, we add bone material to the jaw to help encourage that new bone to grow.
Oh, okay. So it's kind of like bringing in the construction crew.
Exactly.
To like reinforce the site.
Yeah.
Before you can actually start building, right?
Exactly. Yeah. And there are a few different ways to do this. Traditionally we've used donor bone or like synthetic materials. Right. But one of the really exciting advancements, I think, is the use of PRF.
Okay.
Or platelet-rich fibrin.
Oh, yeah. I've heard about this. This is like a super powered healing concoction or something, right?
Yeah, it's really remarkable. So basically, we take a small sample of your blood and we spin it in a centrifuge to separate out the platelets.
Right.
And these platelets, they're just packed with these growth factors, which are kind of like little messengers telling your body to like ramp up that healing process.
So basically it's using your own body's like power to rebuild the bone.
Yeah.
That's pretty incredible.
It is. It's amazing.
Does that mean it actually heals faster?
Yeah. I mean, because you're using your own growth factors, that healing process, it can be, significantly faster, which means less downtime, less discomfort for the patient, and there's less chance of rejection since it's your own tissue.
That makes a lot of sense. Like you're giving your body exactly the tools it needs to get the job done right, quickly and efficiently. But what about those like really severe cases?
Okay, yeah.
Where even with the PRF, it's not enough to really build up that jawbone. Are those people kind of just out of luck when it comes to implants?
Not necessarily. That's where we have another really cool innovation, Zygomatic implants. So these are longer implants that are actually anchored into the cheekbone.
Whoa, okay.
So we're completely bypassing that weakened jawbone.
Wow, that sounds like almost science fiction,
Yeah.
Like anchoring a tooth.
It's pretty amazing.
Into the cheekbone. That's incredible.
That's ingenious.
So they completely bypass the need for having a strong jawbone.
Exactly. Zygomatic implants offer a really stable base for restorations, even when there's a lot of bone loss in the upper jaw.
Wow.
So it's a total game changer for people who, might have been told that implants weren't an option for them.
So there's still hope.
Absolutely.
Even in those like really complex cases.
Definitely.
It seems like there's always a new solution being developed.
There is, yeah.
I imagine these like Really advanced procedures, though, they require a pretty skilled dental professional.
Absolutely. Both PRF and zygomatic implants, they require specialized training.
Okay.
You know, a lot of experience, you know, careful planning, precise surgery, meticulous post-operative care. All of that is essential.
It's a real team effort, then.
It is.
Between the patient and the dental team.
Absolutely.
To get that best outcome right.
Yeah.
Okay, so to sum it all up, right? Even if you've got bone loss, you're not automatically ruled out for dental implants.
Right.
There's some amazing advancements, like we talked about, PRF and zygomatic implants, that can really help create that solid foundation, you know, for a new smile.
And it's really amazing to see how far dental implant technology has come.
Yeah.
Makes you wonder, you know, what other advancements are out there on the horizon?
Yeah.
How else can we use these types of techniques to improve not only our oral health, but our overall well-being too?
It's a great question to think about.
It is, yeah.
As we kind of move forward in this field.
Absolutely.
There's always more to discover, more to learn.
Always.
Hopefully this deep dive has given you a better idea of, you know, what's possible.
Yeah.
Even when you're faced with these really challenging dental situations, it's always worth doing your research.
Yeah.
Talking to your dental professional to see, you know, what might be the best option for you.
Absolutely.